Are you someone who's already come through a cancer diagnosis and a cancer treatment? Whether you went through standard of care, alternative care, or a combination of the two. Were you extremely excited when you were able to ring the bell at the end of that therapeutic intervention and thought, great, I can go back to my life before cancer? Great. If that's the case, listen up. That ring of the bell, that completion of treatment is not an end point, it's a beginning point. I urge you to take a deep look under the hood to see what led to that initial diagnosis, so you can be darn sure that you're not going to repeat this process again. And so you can actually take measures beyond what your conventional team might say is, hey, we'll run some cancer markers monthly for a while or maybe annually for a while. We might do imaging, say every couple of months or once or twice a year for a while. That's their approach of what they call survivorship and making sure that you're responding or had a complete response to your treatment. But that's not enough. Because if you didn't have gut microbiome issues and autoimmune issues prior to your cancer treatment, you most likely will after, as one example, which makes you more vulnerable. It can take up to 2 years after the completion of your standard of care to normalize your bone marrow after the assaults of chemo, radiation, or targeted therapies. This is your opportunity to get very clear on the why, to understand what you need to do to prevent a recurrence. That's what we are specialized in at the Metabolic Approach to Cancer and the Metabolic Terrain Institute of Health. We train our clinicians. We even train our advocates in how to help you become aware of what led to your diagnosis and to be aware of what can help you clean up your terrain so you don't have to have a repeat of that experience.